Hi, everybody. My name is Chris Hayes, and I am the founder of Hayes Physical Therapy and HPT, Optimal Health and Fitness, which is our newest division that we're really excited about right here in Paoli, Pennsylvania. So I opened Hayes Physical Therapy back in 1999, specializing in orthopedics, functional movement, sports medicine, and cancer-related care. And I really had one mission in mind when I opened my practice, and that was to do better. I had come from a very large physical therapy chain, and I saw firsthand how high volume practices really struggle with the care that they provided. And it was very difficult to see consistency because oftentimes in that high volume, patients were getting juggled between therapists, and not even sometimes between therapists, sometimes between PT techs or athletic trainers, but there was a whole big team that was involved in the care of a patient. And I really felt like that really was not in the best interest of patients for consistency. And also, when there is such a high volume demand, there's very little time to problem solve. And there's also very little time to do effective hands-on manual therapy. So learning from those environments, which I also worked in, it really became my mission to do better. And so we at Hayes Physical Therapy now have a team of 5 very passionate physical therapists. And we strongly believe in that quality over quantity. And so we have a low volume practice by design, very intentional. And that is because it's imperative for us to have a commitment with our clients. And that commitment is for consistent care. It is for problem solving each and every visit. It's in helping you get quickly to the root cause of your problem that you came in the door with. And it's to also be able to do effective hands-on care and provide advanced healing modalities that only the professional athletes typically have access to. So in our practice, it's very, very different. And I couldn't be prouder of that fact. So starting with getting to the root cause of whatever you came in the door with. Your physician may send a prescription, for example, for shoulder pain. And so you come in the door with maybe an overuse problem in your shoulder or a partial rotator cuff tear, or maybe you even had surgery. That's where the pain actually showed up. It doesn't really give you the answers. It's a puzzle, really. Where did this problem begin? And that's where we take those extra steps each and every visit to go deeper and deeper into whole body healing, which means not just where this problem has shown up, but did the neck have any contribution to this? Maybe the neck wasn't moving well, or your rib cage was stuck, or your thoracic spine wasn't moving well, or your shoulder blades and your core were very weak and you had a lot of instability, which then created a problem for your shoulder. For example, if you're a baseball pitcher and you're coming in with a shoulder issue, that shoulder problem might be coming from your hips that aren't rotating as you open up into your pitch. Same thing with your thoracic spine. So whole body healing means not just compartmentalizing where the problem shows up. It's much deeper than that. And if you don't explore the whole body in your approach, you're missing important elements that are bound to recur, or that breakdown is going to show up somewhere else. So all of my physical therapists are trained in whole body healing, and we do head to toe functional movement assessments very quickly into your plan of care with us. Secondly, the healing element really is in our hands. And we really believe strongly in certifications in higher level skills, whether it is through active release techniques, joint mobilization, joint manipulation. It's important for us to help you reset the best healing environment for care. Because if you're not moving well, again, you're going to start to alter the way that you move. So it's our job to put those things back in place as quickly as possible. And then to reintegrate with the best functional movement possible so that you're not repeating old patterns. Even with a total hip replacement. Oftentimes physicians are not referring for physical therapy after a total hip replacement because they feel like the rehab is pretty easy. But the piece that everybody's missing is, why did that hip break down in the first place? Was there something else going on that is part of who that person is? And if it's not addressed, they're going to keep repeating that. And so they're going to keep having these breakdowns. So really, really important to be able to change some of those dysfunctional patterns. But the thing I'm most excited about in our practice is bringing advanced healing modalities to all of our patients should they want to fast track their healing. And certainly we use it in traditional physical therapy as well as in our HPT Optimal Health and Fitness. For example, Class 4 laser. Class 4 laser is something that goes very, very deep into an injured area. And it's light energy that actually changes the tissue biology. And it changes it by increasing the circulatory pathways, getting rid of pain and inflammation very quickly. But most importantly, it adds new collagen to that bone-on-bone, total bone-on-bone knee pain that you're having, or shoulder pain that you're having. Or if there's a tear in a tendon at the elbow or the shoulder, it adds new collagen, new healthy collagen to the system. When somebody herniates a disc in their back or their neck, without these advanced healing modalities, the body will attempt to seal that disc with scar tissue. Never the same as really good healing, collagen that you're born with. The laser helps to add in new healthy collagen to seal the wall of the disc instead of scar tissue. So that's really, really important. So it also activates your own stem cells. So we use Class 4 laser often to help to heal the structure, the damage that comes in the door. And our newest device, which we've had for a couple of years now, is called the Newbie by NewFit. And this was once available only to professional athletes. And to give you perspective, in Pennsylvania, we are one of less than 10 practices. I think there's 7 practices, medical practices, that have the Newbie by NewFit. So it's a rarity to be able to have that right here in the Chester County, Paoli area. And as a result, people come from all over to actually work with us with the Newbie device. So the Newbie device is a game changer, and it's unlike anything I've seen in 38 years of practice. And it's so exciting to see the changes that happen with the Newbie. So basically, it is a form of electric stimulation that works exactly like the human body works, meaning that it goes in one direction. It's not the same as TENS units or Russian stimulation or interferential stimulation that fights the body. This actually goes in one particular direction, and it quickly helps us to identify whether you had an injury yesterday or whether you had an injury 3 years ago, where the brain is actually holding you back from healing. And that is exactly what the brain will do. The brain will either perceive that something's safe for it to do or something is dangerous. It's pretty simple. But the brain oftentimes gets it wrong. So somebody that might have an acute ankle sprain or even a chronic low back pain, if the brain is still perceiving a danger threat that hasn't been cleared, then it will actually give you more pain. It'll give you more stress hormones. It'll actually squash your power and your strength. No matter how hard you train in the gym, it's going to turn it off or not to its fullest capacity. And it's going to make everything really tight in that region until that's cleared. So the Newbie by NewFit allows us to find quickly with 100% accuracy where these danger spots are in your body so that we can neutralize them and we can actually have you start to safely move through movement where those danger messages are. And so really, really fascinating process that we do as a diagnostic. And then once those areas are cleared, and when we clear them, we start with simple movements on the table, and then you're in standing, and then you're walking or you're moving off the table. You might be doing some low-level squatting with the electric current on, and it's clearing those danger messages. But there's many other applications to the Newbie as well, where we use it for strengthening, to get those muscles stronger, isolating those muscles. We also can use it for recovery or activating your vagus nerve, which is essential for recovery. And some patients even come in, they don't even have an orthopedic problem, but there's a lot of stress in their life. And they're just on the edge. Their sympathetic nervous system is so upregulated that they have so much pain in their life, and they're not sleeping well, and they may not be eating well. So there's a lot of things that are contributing to a poor nervous system. And one of the advanced healing modalities that we also use is heart rate variability. And that's a study that we can conduct. It's 5 minutes. We do it in our traditional physical therapy practice, and we also do it in HPT Optimal Health and Fitness. But what that study actually does is that it picks up through the heart rhythm your biological age, which is how old are you really? You know, are you a 60-year-old, by birth date, but maybe you're a 70-year-old by the way your body is, your nervous system and your immune system, and how old really are you? And our goal, of course, is always to get you much younger, because that's part of longevity and living a very healthy life that is, devoid of a lot of extra stress. And again, if there's extra stress, it's hard for you to heal. It's hard for you to get better. It's hard for you to get past pain. So the heart rate variability will tell us exactly how resilient your nervous system is, which means how well you can adapt to stress, and how strong your immune system is, and many other really cool things. But it's essential, because if we don't know this information, sometimes people can get hurt with the exercise programs that they choose, especially if they're in a very low state in their nervous system. So really cool stuff that most typically is performed at the high university levels, in the Division I universities, as well as in the professional sports world. Not very common to see this in physical therapy practices, but it is common practice at Hayes Physical Therapy. So there's a lot of things that we're so excited about, and we've seen transformative healing very, very quickly with some of the things that we do. And I'd encourage you to check out either our reviews on this website or check out our Google reviews, because we're really helping a lot of people of all ages. So lastly, the most important thing I'd like to share with you is we just opened HPT Optimal Health and Fitness, and that's a division that's being run by myself. And as that continues to grow, some of my physical therapists will also see patients in this realm as well. And it is a deeper dive into total body health and wellness. So some folks might see us as, after they get finished physical therapy, and then they might join this service to actually work one-on-one with me in the same practice, but in a very exclusive, beautifully renovated space, where we take a deeper dive into total body movement. We take a deeper dive into using the Newbie to actually accelerate your strength training without putting unnecessary forces through the joints. So one of the things that's really exciting is that as we all get older, our bone density potentially gets less, as well as the density of our muscle mass, which is called sarcopenia. And that's why as we get older, sometimes it's hard to get off the floor with ease, or our balance changes, or we just don't feel like we have the same strength that we once had. And on top of that, we might have some structural problems, some breakdown at the knee joint, some bone-on-bone arthritis that we don't want to have surgery on. So how do we get strong? How do you get strong at the gym in the presence of some of these complications? That's my job, to assess these things with you and then design a program that is going to help you get stronger even in the presence of having the structural issues such as muscle wasting or bone density. So we use the newbie to isolate those muscles, whole body healing. So we may be using it on your core and your back or your legs or your shoulders. And what we're looking to do is to increase the size of your muscle mass and stimulate healing as if you were doing 10 times that amount at the gym in just under an hour workout. So really, really effective without loading those heavy, heavy forces through the joints. So I hope that you check us out. I hope you check out the different aspects in our physical therapy practice, from Hayes Physical Therapy, our traditional care that also offers these advanced healing modalities as additional packages that one can participate in. But then if you're ready to do something where you're ready to make a commitment to actually work on your health year-round, we have this program with HPT Optimal Health and Fitness. And happy to answer any questions, or if you have any questions, please feel free to contact our front desk. But we have a lot of exciting things happening here at Hayes Physical Therapy. And I'm really proud of the team that we have. Everyone is committed to helping you heal in the best possible way, from our front desk all the way through to our very talented physical therapist. And it's my pleasure to be able to continue treating patients after 38 years, because it is something that I love to do, and also to be part of this really young, developing team of really great PTs that have their own passions and that bring a lot to the table. And they're teaching me things too. So it's really, really fun. So if you're interested in any of our programs, call us at 610-695-9913. And we really hope to see you either in Hayes Physical Therapy, our traditional physical therapy practice, or HPT, Optimal Health and Fitness. And hope to see you soon.